Total number of deaths associated with COVID-19 worldwide from 2020 to 2021 may be closer to 14.9 million. That's 9.5 million more deaths than reported. That is a staggering jump, Peter. What do you make of these numbers?
Well, Asiya, this is definitely no small potatoes, and a surprise even when we've become numb to seeing a lot of zeros. And there are probably three reasons I can think about why the number is much higher than the official counts. First of all, there was lack of diagnostics, particularly early in the pandemic, even in developed countries, much more for developing and countries where there wasn't that diagnostic that can tell you that this death was due to COVID. Secondly, I think, like was mentioned by the previous reporter, a lot of people just didn't have access to the hospital where they could get the diagnostic and the official death tallied and associated with COVID, so that many of them died at home or before getting to the hospital or the medical system. And then number three, more insidious, I think there was some willingness to not count official numbers as being caused by COVID because of fear that this will stoke anxiety in the population. But of course, as we know, and we know now, information is power, and we really need to know and to let the population know exactly why the numbers are what they are.
Interesting. Well, let me tell you what the WHO said. They say the figure reflects deaths that were either caused directly by the virus or attributed to its impact on health systems. And this is the part I want you to explain to me. Calculated by studying unexpected variations in so-called excess mortality. What does that even mean, Peter?
So it simply means that every year you look back before COVID, 2018, 2019, you expect a certain number of deaths per year in various countries, in the ones that officially reported. You look at 2020, 2021, and now 2022, and the curve are much higher in terms of deaths. So something has to explain that difference, and it's not just COVID. It's probably a little bit of COVID, and that's not counted, but also the not getting to the hospital to take care of your cancer, not going to the hospital because you have chest pain, not being able to get an ambulance to the hospital because you had a stroke. These are all the untold toll of COVID that I think we have to come to a reckoning about.
And these numbers go from 2020 to 2021. We're in 2022. So are we expecting the WHO in a few months to come out and say, oh, wait a second, those numbers weren't really accurate. Let us give you an estimated new tally? Are we going to keep seeing a jump in these numbers and a revised tally, if you will?
Yes, we're definitely going to continue to see a revised tally because these deaths are still happening. Even with Omicron, which is billed as not being that severe, when it overwhelms the hospital system, and that's the reason what I fear the most, is that a lot of people with a lot of things can't get acute care, but that's not even counting chronic care. So say the person needs a chemotherapy course that lasts 3 months, and you have an interruption of 1 month in that course, the cancer can come back, and that undoubtedly leads to, again, excess deaths.
Understood.
When that person could have lived for much longer.
Yeah, it's just tragic all the way around. Okay, Peter, so mask mandates, as you know, are gone in most places. Restrictions have been lifted in most places. Are you concerned at all that we're going to get a summer surge, if you will? Granted, some 67% of the American population is now fully vaccinated.
Yes, I think we'll continue to see increase in cases during different times. Whether or not it impacts hospitalization remains to be seen. I think I'm most worried about, 4 groups of people: those who are over 65 and unboosted, those who are immune compromised, those who are unvaccinated and unexposed, and the people who live with these people, because this all affects possibly people with getting serious illness and then going to the hospital. So I think only time will tell. I think what I'm worried about summer and the fall and winter is that it is enough time for people's immunity from the January Omicron surge to wane a little bit, So then that itself will lead to an increase in cases. Right now, we're seeing BA2 lead to an increase in cases, but it's coming so soon after BA1 that that effect is probably being blunted.
All right, we'll have to leave it there.